Johann G. Jupnik, Olbendorfer Weg 70, USE 15354, D 13403 Berlin 2015, 27. August. Guideline to Help, Proposal of Alzheimer's Disease History in Modern Woman. Dedicated to Susan Sontag, alias Jacqueline Suzanne. What makes Alzheimer's disease candidate to relate to thyroid disorder are mixed edematous plaques in the brain. Pretibial infiltrations occur as well in hypothyroidism as in hyperthyroidism. Pathological to respect herein is intima beta-adrenergic receptor density dependency to triiodothyronine T3 intercellular level, leading to gradually tightened wall of the blood vessel by catecholamines. Further, proportional to T3 levels of catecholamines. Final keystone to lymphocytic interstitial proteinous plaques seen in pretibial mixed edema and Alzheimer's plaques. Maturation of lymphocytes is relying on activated catecholaminagic receptors. Contribution may arise from impaired cytotoxic action of interstitial immune response to deleterial protein in hypercortical state. See later discussion. Impaired permeability of the arterial wall due to hyperreactivity to catecholamines on the ground of hyperthyroidism, late Graves' disease, myxedema, even in an eucorticoid state, leads to suppressed recruiting of lymphocytes, eventually impairs routinely cleanup of the tissue. Impaired activation of immature lymphocytes due to subthreshold catecholamine levels following hypothyroid state evenly causes proteinous deposits, probably slightly shifted to lymphocytic infiltrative pathologic picture, Hashimoto's disease, myxedema, compared to hyperthyroidic pathology. While resilient to minor disturbances in thyroid state situation in the tibial area shows no relevant signs of long-course mismanaging Alzheimer's disease underlying thyroid disorder. Immunological privileged side of the brain does, in a horrible way. A way to get trapped in the levothyroxine cave, besides desirable weight loss over the counter, is hysterectomy. Abrupt decrease of estrogen levels leaves only a part of tyrosine binding globulin in the serum, TBG, followed by the euthyrotic sick syndrome, which is followed by non-clinical but serum laboratory hypothyroidism. Pronounced as decline of corticoid binding globulin, G. After delivery, levels fall from 100 to pregnant, fall from 100 to pre-pregnant, 20 to 40%. In a case of adverse hysterectomy in the course of malignant personality disorder with neurotic function, which was predominantly characterized by a constant series of about a dozen second trimester abortions, the first weeks were characterized by passenger-impaired endurance following clearance of estrogen-dependent TBG and restitution of an adequate pituitary axis regime, probably because of hypertrophed adrenal glands following constant pregnancy due to tetrafold CPG with increased amounts of corticoid serum reserve decay with high corticoid needs. Now a picture similar to Cushing's disease is observed. a dry grafting a kidney should be done before depression and psychosis will occur.